Hello everybody. Today we will study different types of ultrasound transducers, also known as probes. These are designed to emit and receive ultrasound waves for different medical imaging purposes. Each type of transducer has unique characteristics and applications. Let us begin with the lecture. First of all, let us discuss about linear transducers, which have a straight or flat arrangement of piezoelectric elements. Linear transducers typically operate at high frequency, between 5 to 15 MHz, which provides excellent spatial resolution, but limits the depth of penetration. These higher frequency linear transducer have four main applications. Number 1, to scan superficial structures, such as the thyroid, testes, and breast. Number 2, for vascular imaging. Linear transducers are commonly used to assess blood vessels, such as carotid arteries, peripheral arteries, and veins, due to their ability to provide detailed images of vessel walls and blood flow. Number 3, for musculoskeletal imaging, while imaging muscles, tendons, ligaments, and joints, to diagnose conditions like tendinitis, ligament tears, and other soft tissue injuries. Number 4, linear transducer are used for guidance during procedures, to guide interventional procedures, such as needle biopsies, injections, and catheter placements, providing real-time imaging to enhance accuracy and safety. Main limitation is that these higher frequencies limit the depth of penetration, making linear transducers less effective for imaging deeper structures. Also, the linear arrangement provides a limited field of view as compared to curved or phased array transducers, which might be a disadvantage. In some imaging scenarios, their design and high frequency operation make them indispensable in various medical fields, providing clear and detailed images necessary for accurate diagnosis and treatment planning. All linear transducer crystals does not fire at the same time, but rather fired in groups, and emits only parallel ultrasound waves, allowing for the same resolution, both in the near field and the far field. This linear arrangement results in a rectangular or parallelogram-shaped image. Now let us study about convex transducer, which is most commonly used transducer in medical imaging. It comes in lower frequency, typically 2 to 6 MHz. It's called convex because its shape resembles a slightly curved or domed surface. This shape allows the transducer to emit ultrasound waves in a wide beam, which allows it for a larger field of view compared to flat or linear transducers. This means that larger areas of the body can be imaged in a single scan, making it particularly useful for imaging deeper organs, like the liver, kidneys, and uterus. Additionally, convex transducers are often used in obstetrics for prenatal ultrasounds because they provide clear images of the developing fetus and the surrounding structures in the womb. The main advantage of convex transducer is its largest field of view in the near field, but at the same time, because of their design, they have an image in which far field is wider than near field, the disadvantage of which is lateral and spatial resolution are degraded in far field. Remember, these probes are not great for superficial imaging, as they come in low frequency. Next transducer that we will study is phased array transducers. These are used in medical ultrasound imaging to produce detailed images of internal organs, tissues, and blood flow. They allow for real-time imaging and can provide high-resolution images of structures at various depths without moving the transducer. These transducer are also called echo probe, since these has a small footprint that can be easily sit in between the ribs. Therefore, it is main use is in echocardiography, to create detailed images of the heart and measure blood flow through Doppler imaging. It has quite a high penetration depth to be able to show the whole heart, and high temporal resolution, that is frame rate, to depict moving structures, such as the valves perfectly. The image we get from a phased array probe is similar to the one from the curvilinear transducer, in that the sound waves fan out, but due to the small footprint, their origin is very narrow. You can appreciate this in the following image. An endocavitary transducer is a type of ultrasound probe specifically designed for internal imaging through natural body cavities, such as the rectum or vagina. These transducers are commonly used in medical examinations, where close proximity to internal organs is required to obtain high-resolution images. The endocavitary probe has a curvilinear footprint with a wide view, but has a much higher frequency, in between 8 to 13 megahertz, than a curvilinear ultrasound probe. The image resolution of the endocavitary probe is exceptional. The most common applications for the endocavitary ultrasound probe is transvaginal applications in detecting early pregnancy, ovarian torsion, ovarian cyst, fibroids, ectopic pregnancy, etc. Make sure to always place a sterile endocavitary probe, cover with condom or glove, prior to scanning. 3D and 4D transducers are advanced ultrasound probes used to create three-dimensional and four-dimensional images of structures within the body. 3D transducers capture volume data of the scanned area by combining multiple two-dimensional images taken at different angles. This is typically achieved by moving the transducer in a specific pattern or using an array of sensors. Image construction. The collected data from low-dimensional images taken at different angles is combined and is processed by the ultrasound machine to reconstruct a 3D image, which provides a more comprehensive view of the anatomy compared to traditional 2D images. Their main application is obstetrics, widely used to obtain detailed images of the fetus during pregnancy, allowing for better visualization of fetal development and detecting abnormalities. Another great application is in cardiology, where these helps in visualizing the structure of the heart and identifying congenital heart defects, also used in gynecology and urology for detailed examination of pelvic organs, including the uterus, ovaries, and prostate.